We're creating cartels now, hospital cartels in New York, financing in foreign countries in Europe and South America, pay no taxes, controlling businesses, media, and pay no taxes. They're tax exempt. The executive makes millions of dollars. This is just out of control, but they have so much political power now. They accumulated. They pretty much own 80% of doctors now, hospitals. Yep. By law, doctors cannot own hospitals. There's a huge monopoly, cartel powers, and they're not even under antitrust. They're exempt because they're non-for-profit, tax exempt. So the antitrust stuff doesn't even apply to them. It's brilliant, and they're funneling this money through mandatory spending, through rules that Biden allowed them to do. So it's not even goes through appropriation process. Congress never looks at that, and unfortunately, their power is so significant that we're only stopping the damage. But I said, at least, we're not reforming how to make these programs better for the people they intended for. At least let's stop some of these loopholes that really destroying us fiscally.
And then when you see President Trump sign that executive order to level the playing field when it comes to the cost of prescription medications, it is crazy. Not that third world countries, but modern industrialized countries, allies like the UK, they'll pay a tenth of what Americans have to pay for some of the same exact drugs. And the accessibility they have to it is just incredibly easier financially than it is here in the United States. You talk about the cartels, you talk about the super PACs and all the influence that's kind of preserving the bubble around the big pharma cartel. Hitting them in the wallet with the way President Trump is looking to do it with this executive order is probably a good start to getting there.
Listen, he actually did even more powerful executive order on price transparency in February. And that is really, really important one. And I hope, we need to put pressure on his administration and his agency actually start implementing them, because they have to issue rules, and it's been 90 days. And I'm very disappointed that they still don't have drafted rules to implement that. But that is actually would allow the American people to see how they're getting screwed. Because I think when American people will see what they get in charge and how much it's really cost, and I think people will be very, very pissed off. And I think they're afraid of that, because Americans being really, just generally screwed by large healthcare cartels, insurance, PBMs, hospitals. And that was the challenge is. And I think the price transparency will show the people what really the cost, and what is really the price of healthcare should be, and not what we're paying. And if you look at all of the money they're making on us, this is just something the federal government subsidizing. How many, what their CEOs are making that we're giving them, but people losing benefits, going bankrupt. 1 in 7 Americans insolvent on medical debt, destroying people opportunities, people not getting the right healthcare services. We have some of the worst outcomes from developed countries. Some of them spend more money than anyone else per person, but has the worst outcomes. They're just not acceptable.